Welcome back, Trinidad and Tobago. And joining us on set, we have Dr. Ocho and we also have Debbie. And they're both here to educate me and you, really, about ophthalmics. It's a tongue-tied. I'm going to try to not say it many times during the interview because they're the specialists. But we're talking about nursing care and the prevention of blindness. And did you know that there's a speciality in nursing? Well, Debbie's attached to the American Association for Ophthalmic Nurses. And they're here to talk about an event that they're having. Good morning. Thank you for joining us.
Good morning. Pleasure. Good morning.
Dr. Ocho, let me start with you. The Ophthalmic Nursing Specialization Seminar. That's a mouthful.
Yes.
But is the specialization in Trinidad and Tobago, is it something that is known? Are people subscribing to it? What exactly is it?
No, I'm glad you asked, and thank you so much for having us here. This is a new specialization that we are intent on bringing into Trinidad and Tobago, bearing in mind that we are having more and more issues of blindness, more and more persons having cataract extractions, and so the Department of Clinical Surgical Sciences has teamed up with UWI School of Nursing to bring our guests the current president of the American Society of Ophthalmic Registered Nurses to put on this seminar as a sensitization as we look at building the consciousness and the importance of nurses taking on a more strategic role in ophthalmic nursing.
What does the specialization entail, Debbie? How different is it to just doing, what is the course material like? What is the qualification like, the process?
Ophthalmic nursing is a specialty, and healthcare has become so complicated, and the technologies that are coming out, the new medications, the new procedures, that it is really hard to keep up with everything. And so specializing seems to be a way to be able to provide the patients the best quality of care. And so for nursing, the ophthalmic nurse might work in surgery and assist in the care of the surgery patient for cataract surgery, retinal surgery, maybe glaucoma surgery. They also work in the clinic doing the assessment and collecting all the data. There's some very high-tech testing that is done with machines that either can print out the results, or in a very high-tech setting, it can be connected to the electronic medical record and automatically go on there. So the nurse is involved in doing the assessment of the patient, maybe patient teaching. Patients with diabetes need a lot of education in keeping their diabetes under control and not resulting in any diabetic eye disease. Glaucoma and the medications, to understand the importance of their eye drops and what it's going to do. So the nurse can work in surgery, in the clinic, they can be out in public health, but it's a very specialized knowledge to be able to understand the anatomy, the physiology, the pathophysiology, and then the nurse brings their nursing experience, their nursing education with them to be able to provide that care to the patient.
Dr. Joe, I see that in the seminar you have a number of topics that will be addressed. And one of a day in the life of an ophthalmic nurse. What is a day in the life of an ophthalmic nurse?
I'm going to do that course, actually. And it runs through what the ophthalmic nurse does. And I have it in three different areas. One, the ophthalmic nurse in the surgery arena. Mm-hmm. So admitting the patient, what they do with anesthesia, actually in the operating room, and the scrub tech that is in there, and the circulating, both nurses, and then the PACU and the discharge of the patient. That is the surgical arena. Then there's also the hospital, and what the nurse does for the patient who is in the ward, the ophthalmic patient. And then the third one would be the care of the patient in the clinic area or the office, and what the nurse would do, just kind of following a patient through.
Dr. Ocho, this is about, I guess, sensitization, but also getting people to be excited about this.
Yes.
I have to address the elephant in the room, the cultural relevance and also the disposition of our current nursing profession. There are issues with that, not only the exams and the council, the unions, but also the attitude. And How are you going to address all of that to get first world practice and allow them to, some say they can't even get what we're doing right now. They're amazing nurses, but there are others which you understand exist in the system. How are you going to get them to do something even more?
Well, that's a very interesting question that you have asked. And at the UWI School of Nursing, we are extremely concerned as well about this particular issue, about the attitudes of nurses, and therefore critical to our curriculum is the whole issue of ethics and professional behavior. We stress that throughout the curriculum, and in fact, the Faculty of Medical Sciences, of which UWI School of Nursing is a part, we have been doing a lot of work on ensuring that as interprofessionals, we understand our responsibility to each other, but more importantly, that the most important person who is our reason that why we exist is the patient. And therefore, if our attitudes and our behaviors and our professional performance is not up to scratch, then we will be doing a disservice. And we are very committed to ensuring that the product that graduates from UWI, we speak about the unique UWI graduate,
right,
not just about the experience, because we want people to recognize that when you graduate from the University of the West Indies, you are representing a regional institution.
Ophthalmology is a risky business, real cases. I see that's another issue that you're addressing as well. Is that a doctor's issue or a nurse's issue?
Well, it is both a doctor and a nurse's issue, because the nurse has a critical role to play in supporting the doctor as well as supporting the patients as it relates to the health promotion end, the education end, the assessment end, and also the interventions, either pre-surgery and post-surgery as well.
In terms of the event, now it's taking place on the 30th of November.
Which is tomorrow.
8 o'clock to 4 o'clock at the UWI School of Nursing, and it's in El Dorado. Who should attend and why should they attend, Doctor? You have the final word.
We want all nursing personnel to attend, whether you're an enrolled nursing assistant, whether you're an RN, whether you are a district health visitor. It's really going to be a very rich experience. We're having the president here, Debbie, as one of our presenters. We have Dr. Murray, and we are also having an internationally renowned expert as well in nursing, Dr. Alethea Dean, who has been doing this kind of work around the world. And so therefore we're encouraging people to come out. It's $200. If you're a student, it's $100 with a valid ID. You cannot miss this lifetime experience.
Debbie, you have the final word this morning. You have dedicated your life, and now you're the head of an association out of the U.S. What does being an ophthalmic nurse mean to you and bring to you?
It is so exciting to be able to help a patient to see again, like after cataract surgery, to take that patch off and to show them the screen, and they're just so excited to be able to see. There's nothing like giving a patient back their vision.
So definitely something to be part of and to look forward to, and it's about nursing care and prevention. I see that you have some booths and you also have items that are on display as well.
Yes, we are having some of the sponsors. They would be displaying some of their materials, so it's going to be a rich experience.
Definitely be part of the event. We'll take a short break. When we come back, we'll have more for you. Stay with us. This is The Morning Brew.